Hello and welcome everybody to ICMDA webinars. I'm Dr. Peter Saunders, the Chief Executive of the International Christian Medical and Dental Association. And today on ICMDA webinars, we've got Dr. Mike Soderling speak to us on the subject of a Christian healthcare perspective on Lausanne 4, the recent fourth Lausanne conference in South Korea. So for the last 10 years, the Lausanne Health for All Nations network has been striving to help the global church to understand health from a biblical perspective, and with that perspective to actively engage in caring for the whole person wherever he or she exists. Of equal or not greater importance is that the church embraces caring for the whole person in the way of Jesus, so that people from all ethnic groups can hear about Jesus and that many will come to faith in him. Lausanne 4 in Incheon or Seoul in South Korea last September could play a key role in seeing this all become a reality, but only if certain conditions are met. And Dr. Mike Soderling is going to discuss what those conditions are. Dr. Mike graduated from Medical College of WIS and was in private practice, OBGYN, for 10 years before serving in Central America for 11 years. And on returning to the US, Mike became director of the Center for Health and Mission, now known as the Institute for Global Health at WCIU. And in 2013, Mike spearheaded the petitioning of the Lausanne movement leadership to add an issue network focusing on health. This petition was successful, and the Health for All Nations network was birthed. And Mike was also part of the leadership team for GAP 13 on holistic health, one of the breakout sessions at Lausanne, and is involved in ongoing collaborative action teams. I think being part of the leadership team and being involved is probably an understatement. Mike was very much the driving force with GAP 13. And Mike, it's just a privilege to have you here today. And we look forward to hearing your insights and to engaging with you in Q&A afterwards. Over to you, brother.
Thank you, Peter. It is my honor to be here. And I know that many of you attended the conference, the gathering in Seoul. Peter was there helping us with GAP 13. I'm sure many of others were on this call or on this webinar were also present. Before we start, I wanted to just use a proverb to start as my prayer. This is, Psalm 19:14. Let the words of my mouth and the meditation of my heart be acceptable in thy sight, O Lord, my strength and my Redeemer. So I pray that we do keep our focus on the healing ministry of Jesus and what that means for us today. So the theme for the Lausanne Congress was let the church declare and display Christ together. And as Peter mentioned, it was held in Incheon. And there's an interesting history with Incheon. It turns out that's where missionaries first entered the country. And Incheon is directly next to Seoul. So it's Incheon, Seoul. And just some statistics there. The first Lausanne meeting, for those who are unfamiliar with this movement, was convened by John Stott and Billy Graham, and the focus was world evangelization. And this was in Lausanne in 1974. Thus was birthed the Lausanne movement. The second Congress was in Manila, 1989. I'm not sure anybody on this call is old enough to have been there, but perhaps some. Cape Town 2010. Interestingly, Cape Town, there was some language, there were some articles written about health, excuse me, about health in a whole holistic approach to doing ministry by a lady by the name of Abby Campbell. 2014, 2015, we, as Peter mentioned, made this petition to Lausanne because when we looked at the content on their website, there was nothing to do with health, healing, or wholeness, even though that was a central part of Jesus' ministry. And this is the fact that we keep coming back to, was that at every turn, this is the sort of thing that Jesus did just naturally. So we asked them if we could start an issue network. And at that time, it was the newest issue network. And it is now known as Health for All Nations. Then, of course, in 24, last September, was Seoul Incheon, 5,000 plus attendees. Many people attended virtually. The experience virtually was kind of a mixed bag, but I was just talking to a physician from Hong Kong this morning who had done it virtually, and she had become plugged in because of that. There was a lot of diversity. This is something that we've strived for with each gathering, is to increase the diversity, especially from the majority world and from both genders. The preparation and organization was just out of this world. I thought it was excellent. Technology played a big role, but the overall theme coming out of it was collaboration. This is the main stage, the venue. We were all in this hall together, all 5,000 plus, and we were centered on tables. So we each had a table number that we maintained and stayed with the whole week. This is the shape of the Congress. Our gap sessions were these afternoons, 3 to 5 p.m. The other presentations, the plenary speeches, were excellent. Not without their controversy. There were, I think, when you bring together this wide of a variety of church leaders and church participants, there's always going to be something that ruffles somebody's feathers because of the way it was said or because of the focus. But overall, I thought the week plenaries were just an amazing presentation. And then in the evenings, we also had some time together. So these afternoon sessions was a lot of work. I will say that. And I'm thankful to all those on this call who participated. Lausanne put an enormous amount of work into this event. It was all centered on these 25 gaps that were identified. And Lausanne, over many years, like 5 years, did kind of a global questioning process where they tried to identify the gaps that existed in our attempts at evangelizing the world. There were actually 50 or so, and they kind of diluted it down to these 25, and holistic health was 13. Now, if we hadn't petitioned them in 2014 to have this focus, this would not have been on their agenda. So we were very thankful that they made this a theme during this week. So the aims of the Congress was really to prepare and train every participant with tools that they could use to become a part of a collaborative team. The criticism of Lausanne gatherings in the past was that they were large meetings and lots of good conversation happened, coffee and tea were shared. But for the most part, people went home and got busy and went back to what they were doing without kind of creating too much of collaborative effort to change things. That's not to say that there weren't very significant ripple effects from the previous congregations, but this one was specifically designed to create these collaborative action teams. And that was in order to accelerate global mission by helping intergenerational participants getting together with affinity groups and other networks so that we can actually start to see some strong collaborative efforts. The afternoon sessions, the first one was on a listen. I'll just go through these quickly. The first on Monday was listen. So it's just kind of what are you experiencing? What are you seeing in your context? These were all written up and then transferred over into They used AI to transfer the information into a document that we're about to come out with. That's a summary of our time together. Step 2 was imagining what the future might look like if we were to collaborate. What is it? What is the difference we can make by 2050? This is something Michael O talks a lot about. Is yes, this gathering is important. It's worth doing, but what we really want to do is think about 2050 and beyond. What is it that we can collaborate on now in order to see change by 2050 in these gaps? The third day was Thursday, so we had a break on Wednesday, was create. What is it that you can do? What are some of the ideas that you have that could successfully overcome the gaps that we've identified? And specifically ours was the gap on holistic health. And then the fourth day was Friday, which was communicate and commit, actually. So in the final session, all the participants were given the opportunity to sign a statement of commitment. I signed it. I think most people did. And I look at that document on a regular basis as a means of reminding myself that I made this commitment. I wrote my name on that document that I would be a participant in a collaborative action effort. Here's our group. Unfortunately, I think Peter was somewhere else because I could not find him in this picture. But here is our group. And we had close to 100 some participants. A very strong emphasis, I think, was on mental health and trauma healing. So there was a group that formed afterwards on that theme. So as you can see, it's extremely diverse. I don't know the ratio of male to female, but I think it's probably close to 50-50. Terrific representation from all regions of the world. So we were very happy with how that turned out. Post-Congress now, the Collaborative Action Leadership Forum is managing the collaborative action teams. And some of you may already be participants in a team. There will be information on the last slide as to how you can get connected if you aren't already. But we had one of the most difficult parts of the week was the app that they gave us to use to form our collaborative action teams crashed on the first day, the first time we tried to use it. So that created a certain amount of angst amongst the leadership. But they have since transferred all of the content that we came up with into a different online format within something called Mighty Networks. And Mighty Networks is a fabulous tool. I have friends that use it, and they really, really like it. So they've got a really good platform now that makes it, I would say, easy to communicate, to upload documents, and to create the collaborative action teams. So those are a couple of changes that happened. Some of my reflections on the time was that there is still this tension, and I think it's been there for centuries, this difference between those who want to take social action in the name of Christ and those who think evangelism is just all there is that we really need to do. So the emphasis on evangelism as the primary mover over and above social action is still this tension, the balance between those is still something that we find difficult, I think. So you have those who are in the proclamation evangelism camp. And if you're not talking in your group about how you're going to proclaim the gospel in this group, make Jesus known and plant churches, then we don't really want to talk anymore. Versus those who may have more of a, well, like we talk about, Jesus was all about healing people and making them whole. And in that process, there will be opportunities for evangelism and proclaiming and stating your faith in Christ. And of course, some of this is context dependent. So if you're working in, East Africa in a predominantly Christian culture, it's going to be one model of evangelism. If you are in Mauritania and working as a Christian healthcare provider, it's going to be a different means by which you get to discussions about Jesus and spiritual matters. So there's still that tension that exists. There is still the ongoing challenge of the haves and have-nots. That's probably not a very contemporary way of putting it, but you get the idea. There is always this tension between those who have the material resources, primarily money, and those who are still struggling with running a mission hospital that's in the middle of nowhere, India, serving the poorest of the poor, trying to figure out how to survive and how to flourish, let's say. So this tension, again, between those that have the material resources, and the fact is that still is the West. But I think the thing that the West needs to understand is that the most valuable resource is the human resource. It's those who are doing the work on the ground in the most difficult places. And the material wealth side of it is really secondary to that resource. And so we still have a lot of work to do between that balance, right? There was very little focus on Hindu and Buddhist outreach. There's a lot going on, and I'm part of an organization called Frontier Ventures, which was birthed out of the first Lausanne meeting. We used to be known as the U.S. Center for World Mission, where Ralph Winter started the Unreached People Group conversation. So this is something that we talk about all the time. It's like we hear a lot about movements to Jesus in Iran and in very difficult places that are Muslim contexts, but minimal about anything going on in the Hindu and Buddhist worlds. There may be some, but it's not talked about very much. So that was kind of a miss, I would say, on the part of that week. I just think the church still struggles with this fundamental calling that she has to care for the whole person. It is, something that is hard for us to understand when we know the value of that. We know the value of being able to care for people in their greatest need, to be compassionate, to be willing to listen to them, and to be willing to actually touch them to help them become healed. And we know the value of that to bringing people into the kingdom. But for some reason, the church herself doesn't seem to be able to fully grasp how valuable that is. And we hope that as we continue knocking on that door, that the church will awaken to ever greater degrees to that calling. The soul statement, so each of the three previous Congresses came out with statements. So that most of you are probably familiar with the Lausanne Covenant. Many use it as a statement they refer to. The Manila Manifesto came out after 89 Congress. The Cape Town Commitment came out after the meeting. But in this case, they decided to release the soul statement on the Monday of the meeting. And this stirred all sorts of controversy. Why weren't we given any opportunity to give input into this statement? And we felt the same way. We feel like the statement falls short of saying anything about what we're passionate about. And so we have written up, it's not really a rebuttal, but it's our response to the soul statement, which will be coming out shortly. So I think the potential for this gathering and the impact in missions is tremendous. one other significant point that Peter alluded to at the beginning is that desire of ours to pair up caring for the whole person, and in places where the church doesn't yet exist. I was just talking to somebody from a physician from Hong Kong this morning with an organization, I won't mention the name, that started as a Bible study about health. This was 170 years ago, so you may be able to figure out what organization it is. But I asked, is that a focal point now for the organization that was started because of a Bible study about health? And she was like, not really. And if you talk to healthcare professionals who are part of the larger organizations, I won't name names, but many of them have healthcare professionals, but there are very few, if any, that make it a priority to use whole person care. I call it whole person care in the way of Jesus, at the frontiers of mission, where the church doesn't exist yet and where Jesus is not yet known. So we have a lot of work to do, and it's going to happen through collaboration. And I encourage participants in this call, if you are not yet connected, to become connected, and I'll make this all available. The Lausanne Action Hub is the entity that exists within that Mighty Networks app, and a lot of action going on there, although it's slower to progress than we had hoped. It's going to take perseverance and patience to really see the results that we want. Within the Action Hub is the Health for All Nations Issue Network. You can join that. And then there is the GAP 13 collaboration. We have several collaborative action teams that have formed already. One has to do with climate change and global health. There's another on a theology of health, which we would like to see developed for the church. There is one on nurses, advocating for recognizing nurses for the value that they bring into the most difficult places in the world. They don't get enough credit for what they do. We have, what's another one? Another one on justice and anti-corruption. So we hope to form some teams, and we have one person in Ethiopia who is going to have a team built around her to help her to confront the corruption that she sees in the healthcare system in her context. So there's all sorts. I mean, the number of collaborative action teams that could form is limited only by your imagination. So I think I'll stop there and take any questions you might have.
Yeah, brilliant, Mike. And we've got a lot of time for interaction and questions. So there's lots and lots to talk about this. This really is a incredibly strategic meeting of evangelicals, over 5,000 Christian leaders from over 200 countries all around the world. So quite phenomenal, and a real privilege to be there. And Mike, thanks very much for that, for setting the context so well. For those who aren't as familiar with Lausanne, that was a really brilliant overview of the whole history of Lausanne and the makeup of the conference and the way it worked with the theme of collaboration. So can I just ask you first off, as the questions start to come in, you mentioned right at the beginning that after Cape Town Commitment and after Cape Town Lausanne 3, and we were both there, and I remember being a bit disappointed with the lack of healthcare emphasis. There was certainly a recognition of HIV, but not much else. And then, as you said, there might not have been even a Health for All Nations network had you not gone back and made the suggestion and offer a few years after Cape Town. Just your reflections on, why do you think it is that healthcare, in a sense, has been a bit marginalized within a movement that's so focused on bringing words and works together, bringing proclamation and service together. What do you think the reason is for that? Or the,
Because I think it basically comes down to a misunderstanding of health. And of course, my context is a Western context. And when we talk about health in conversations in the United States or even in the UK, it's primarily going to be centered on physical health. So at my age, I'm talking about my bad knee and my sore back and, other things like that. And we don't think of it holistically. And I think this is because healthcare has become so technical. And in the mid 19th century, I think is when the turn really started to happen because you began to get anesthesia, aseptic surgical techniques. In the 1940s came penicillin and antibiotics, surgical technique, and it became a very super technological profession.
yeah,
It used to be doctors would visit the home. That all changed, and you don't get home visits anymore. Hardly even with nurses. So everything has been focused and honed in on the hospital, on the clinic, on the technical side of things, and we forgot about the holistic, integrated nature of what it means to be a human. I think another part of the problem is that our seminaries don't recognize or understand health from a biblical perspective, and so they don't teach it. So we continue to produce seminarians, pastors, church leaders who don't grasp or appreciate the importance of the way that Jesus did it, the whole person nature of his work. I think some in the church think it's too expensive to get into. I mean, they just all they look at is the cost. This is going to be too expensive for our church. There's no way we can do it, so they don't. I think those are some of the main reasons. I don't know if anybody out there is a Jacques Ellul fan, but he wrote about the Technical Society back in the 60s. Kind of a radical thinker guy, and I think he was right on with what he was talking about when it came to the predominance of technology and how it just has shaped so much of our world and shaped so much of what we do.
Sure. No, thank you. And you mentioned the soul statement, and of course, out of each Lausanne conference, there's been a really meaty theological statement that's come: Lausanne Covenant, Manila Manifesto, Cape Town Commitment, and now the soul statement, which, as you say, was written and released quite early in the piece and caused a bit of controversy there. I know you've done a lot of reflecting on this, and as you say, you've collaboratively written a response to it, which is going to be published soon. We don't want to preempt that too much, but be interested in your reflections on, particularly with healthcare, what you felt the main emphases of the soul statement were, and what areas you felt perhaps needed a little bit of beefing up or response.
Yeah, the soul statement does. I'm trying to remember the details, but from what I'm remembering, there was talk about what it means to be a human. And when I brought up what we were talking about, they said, well, that's where you fit in, is the discussion on what it means to be human. And that also, they also talked about AI and what artificial intelligence is going to what impact it's going to have. But there really wasn't anything specific about our cause. And I had actually written several emails to the coordinators of that group ahead of time and have since written them again. But the soul statement will not be changed. They've made it clear they're not going to modify it. But the most that I think we can do is through our statement, make our case. And that'll hopefully be published on the Lausanne website. And we just build on what we have. We can only do so much. But I think as we'll be the the widow that continues to knock on the judge's door until he opens it and takes and listens to her case and agrees.
Yeah, and as you say, of course, the judge did open the door, and he was, I'm sure, far less predisposed to the widow than Lausanne to healthcare. So we should certainly keep on with that. Now, you mentioned the Hindu world, and we all on the way to Lausanne got loads of stuff to read. If you're anything like me, even a 8-hour plane journey, I didn't get through it all. And there were many things that struck, but one of the big take-home messages for me reading that material was that the majority of the unreached people groups in the world are actually in the Indian subcontinent, and particularly in India, and coming from a Hindu worldview perspective. And yet, as you say, there was quite rightly an emphasis on Islam, but it wasn't matched by concern about Hinduism and Buddhism, perhaps as much as it could be. People are suggesting also we should add Confucianism into that in the chat.
Sure.
So, but I wonder just to get your thoughts about the role of healthcare in mission in a Hindu context, and particularly in the Indian continent. There's a lot of history there, but have you got any thoughts on that? I know you don't come from that area, but you're thinking about these things.
Yeah, no, I think it's key. We had a presentation about 2 months ago from a Buddhist background believer, and the description that they provided with regards to the worldview and how Buddhists understand the world makes it very amenable and very receptive to the healthcare, the whole person care model for reaching people, because it's very integrated, it's very all person. And at the end of the presentation, I said, do you think that healthcare provision in this way, in a whole person way, is a valuable and useful tool for reaching Buddhists? And he was like, it may be the best way of doing it. And in the Hindu context, I don't know if I should use his, well, I don't think he'd mind. Binod Shah, previous ICMDA leader. I recently got
a webinar on Hinduism just a couple of weeks ago too.
Yes. So I asked him about this, and his family was Jain, and I forget the state that he grew up in. Anyway, he said, Mike, it's so valuable. He said, my father, when he was in his 80s, came to live with our family. But when he came, he said, you are not going to talk to me about Jesus, because I am not going to become a follower of Jesus. I'll come and live with you as long as you don't talk about Jesus. And Vinod said, that's fine. That's fine. But what he did was he hired a Christian nurse to care for him. Compassionate. I don't know if she was probably Indian. But then after, what was it? A couple of years, I think he said, that nurse came to me and said, your father wants to know how he can pray to become a follower of Jesus. So it's extremely valuable. People, the challenge in Hinduism is the upper caste. So you'll probably hear lots of stories about the Dalits and the untouchables coming to Christ in large numbers. That may be the case. Hard to track that sort of activity. But the upper castes have been extremely challenging to reach. Sometimes because we don't do it in a contextualized way. But healthcare, if Vinod were here, he would say it is absolutely one of the most valuable types of ministry in reaching people and thus reaching people groups in that context.
Thanks, Mike. You mentioned the main theme of the Lausanne 4 was collaboration, but also you mentioned the CATS, the collaboration action teams, which was set up, and you named a few of those. We'll we'll get the whole list of healthcare ones from you for the letter that we send people tomorrow, because that'll interest people, I'm sure. But so there was theology of health, justice and anti-corruption, but also nurses as well. And we've got a question here from Steve Fouch, who is the head of nursing ministry.
Hey, Steve.
You know Steve
Yep.
well at
Sure.
Christian Medical Fellowship UK. And he's saying, Mike, can you say a bit more about the nurses network discussion, a bit more about the nurses catch?
Sure. Right. One of my co-catalysts is Martha Moenda Falumba, who's a nurse in Zambia. And it just occurred to me over the years, from my being in various contexts, that nurses in the majority world are doing the majority of the work. But in Guatemala, it wasn't uncommon to visit a rural clinic or a rural hospital and hear that, well, the doctor's supposed to be coming, but lots of times he doesn't show up. And if he does, maybe he's had a little bit to drink and he's unreliable. So it ends up being the nurses oftentimes who are doing the majority of primary health care, but they don't get credit for it. They are not trained as what we would consider to be a nurse practitioner, and yet they're expected to care for people. So this network, Martha's actually going off as a catalyst this year. She's with Nurses Christian Fellowship International, and she was really keen on getting this conversation started and to start doing something about it. So the point of that collaborative action team will be raising awareness, sort of an advocacy focus, raising awareness to the reality for nurses and advocating for, I suppose, better educational systems for them, and then credit and compensation actually for the amount and type of work that they're doing.
Thank you.
Happy to have you on board, Steve.
Yeah. Really grateful for all the work you do. And of course, Steve's a member of CMF UK, which includes nurses as well as doctors, but not dentists, interestingly, but also has been very active in NCFI, the Nurses Christian Fellowship International, which is a very close sister organization to ICMDA and is similarly global in its aims and reach. Now, looking forward, you talked about 2050 as the forward scope. What would we like to be seen by then? And there's a real sense, so refreshing about Lausanne, is there's always such a sense of, let's get the Great Commission done. And, we've got all these areas still to reach. Let's dream big for 2050 by God's grace and see. But John Warlow is asking here, so thanks for the presentation. What would your prayer and hope and vision be for 2050 for holistic health in a global perspective, in a Jesus way, as you said in your talk? That's a big question.
Yeah, that is a big question. I mean, obviously, it would be nice to see significant progress on reducing the number of unreached people groups. And you mentioned, Peter, that it's primarily India, and I would say it's primarily northern India. Very, very challenging and very restrictive. But by 2050, the big, hairy, audacious goal would be that all people groups, all 13,000 plus people groups would have a church and a witness for Jesus, and people would have access to know who he is. That's kind of like the Alma Ata Declaration of 1978, Health for All by the year 2000, right? We know it's not going to happen, although I don't want to seem like I'm limiting God and what he can do. But by 2050, I would love to see progress having been made because of the way that we do whole person care at the frontiers of mission, where the name of Jesus isn't yet known. So maybe a realistic goal is that we have halved the number of unreached people groups, and that healthcare, holistic healthcare, has had a large role in that. by 2050, I think it would be uh, a great goal to see many seminaries and Bible colleges that are putting the whole person care idea into the DNA of their seminaries. I don't think seminaries do a very good job in general of preparing seminarians and pastors to live healthy lives themselves. And in fact, in the US, our pastors are some of the most unhealthy people and most stressed. And yeah, they're they're in bad shape, many of them. So I think that would be another one. I think seeing a significant number, and I can't put a number on it, but I think seeing a number of healthy churches embracing whole person care to be this sort of the center of what they do in their community would be another great thing to see happening.
Amen. And
I mean, there's a whole bunch of others,
yeah,
other things.
we're only just scraping the surface, aren't we? And healthcare is such an incredible bridge into unreached people groups and a gateway to bring the gospel into many places where it hasn't been heard. Now, you mentioned the Alma Ata Declaration, and Martin Back is asking here, do you talk to, I mean, just looking back over the last 20 or 30 years or so, it's extraordinary the inroads that have been made in health, whether it's in reducing maternal mortality, neonatal mortality, child mortality, poverty, eradication of infectious diseases, HIV, and so on. And a lot of this has been driven not so much by Christians, but by global North philanthropists, if you like, and also organizations like the WHO and so on. So Martin is asking, do you talk as part of the Lausanne Healthcare Network, do you talk to WHO and get a positive response? And to what degree can and should we be engaging with non-Christian organizations who share our commitment to seeing good health, but not obviously our faith commitment?
Yeah, right. The amount of work that we have to do just within the church has limited our connection with the World Health Organization. There is a recent conversation that we've been part of, though, that I can't remember her name, Sally, somebody has been trying to get us connected with.
Sally Smith, I think, at WHO.
Yeah, that's right, Sally Smith. I have not been keeping up with that conversation, frankly, because of how much there is to do just within the church. But I see no problem with it. I think it's absolutely where our people should be. What you said, Martin, is true if you look at the statistics. A large portion of that, I would say, is what's happened just with China. Mm-hmm. So the statistics have been improving, but just look at what happened in China. So the progress they've made in the last 30 years in improving the standards of living in China has had a huge impact on the general statistics of the world.
Yeah.
I think progress has been made in India. They've got some amazing stuff going on in India with primary healthcare in the villages and the communities.
Yeah.
But it is, again, still a technical progress that we've made. I'm not trying to minimize the fact that, we're reducing HIV death from malaria and all such things. But in some parts of the world, there hasn't been much progress. And what I would say also is that we're in this weird transition time where many of the countries are making progress on the communicable diseases, but what they're experiencing now is an explosion of non-communicable or rich country diseases.
Right.
And I've heard this from my India connections. Mike, our pastors are they're obese. They've got high blood pressure. They've got metabolic syndrome. It's just terrible. So you've got this really difficult combination happening at the same time within places like India, where
Yeah.
communicable diseases may be going down, but the diseases of the rich, obesity, diabetes, and all that are going up. And it's a very, very difficult transition, I think. I hope
Yeah.
that answered the
And
question.
you're absolutely right that the blanket stats, of course, are getting better, but they disguise regional variations. And of course, the huge populations of China and India skew that, although, of course, South America. And yet in many places of sub-Saharan Africa, for example, things are still very bad in terms of, maternal and neonatal infant mortality and so on. There's a question here. David Bowen is asking, you say one barrier is churches seeing engaging in health as too expensive. Now, does that suggest that they see engaging in health as adding clinical services, such as, hospitals, clinics, and so on, rather than a normal extension of the church's role in the community, a more social and communal model than clinical model? And I think you've hinted at that already by talking about the rise of non-communicable diseases, which are often lifestyle related as well.
Right.
So just if the church is to do more in healthcare, what sort of shape should it be having?
Yeah, that's another one.
Engaging with pastors.
Right. Yeah. Thanks for the question, David. And this is a webinar all on its own. So how should the church be involved? I'm not advocating that we go back to the church opening hospitals, at least not in my context. I know that there are some who are still going down that path in Africa. I just got asked about consulting with somebody yesterday for that in Nigeria. There is a need for that side of it. But my basic premise is what we call primary health care, which they defined at the Alma Ata meeting in 78, I think is something that the church can do. Primary health care, getting people to buy into preventive health. We have a new movement in the US, I think it's growing in the UK, on lifestyle medicine, actually as a profession, as a subspecialty. And those are the kind of things that the church, I think, should be active in. How do you eat healthy? How do you care for this house of the Holy Spirit? And we don't talk about that stuff. And like I said, I think our pastors are some of the most unhealthy people on the planet. So I think that I don't see a good reason why a local church can't be what I would call a primary healthcare center. If you look at the definition for what primary healthcare is that came out of Alma Ata, I think it's very doable. I'm not, talking about hospitals and doing surgeries and stuff like that. So I think it's a realistic goal. The other thing I was going to mention in response to the other question was the growing problem of loneliness.
Yeah.
So loneliness, if you're experiencing it, it can have an impact on your health equal to smoking 10 cigarettes a day. And I think that is something that the church should be really good at overcoming, is the loneliness epidemic. So David, I hope I answered your question. I think the church should be involved, and I think it behooves us to think creatively in whatever context you're in on how to do that.
Thank you. Christina Alakanian, who you will also know well through Lausanne Connections, one of our field workers. And she's asking the bigger question of, how do we awaken the church to grasp the reality, to care for the whole person, in a way that we've been talking about, modeled on the way that Jesus himself Great.
Thanks, Christine. Yeah, it's another, an entire webinar again. It's patience. I'm reading a really good book now called The Patient Ferment of the Early Church. And patience in the early church used to be one of the virtues they talked the most of. And so I think we have to be patient in our expectations. But I think we just keep knocking on the door. We have been knocking on the door of the WEA as well. David Bowen has been part of that, thankfully. Knocking on the door, helping them to see and grasp the importance of this. You can do it with local churches. It's not easy. It's baffling, right? When you bring this up to a pastor and say, well, how did Jesus do his ministry? Let's look at this passage where he healed a woman with 12 years of bleeding. It's a great example. Well, yeah, that sounds good, but it just sounds too expensive because they think they're going to have to put on staff a bunch of doctors and nurses and it's going to be overwhelming. But it's just a matter of continuing to knock on the door, think of creative ways of introducing the idea, being patient. And I say you have to be the mosquito at night, right? So most of us have probably experienced trying to get to sleep at night and a mosquito is buzzing around your ear. And eventually they get up, turn on the light, and they deal with the mosquito, right? So I think eventually that this is going to seep into the church. And with our continued efforts with Lausanne and WEA, maybe Micah Global, the work that ICMDA is already doing, we are going to make inroads that are going to be noticeable.
Well, we've had two great metaphors now for patience and persistence. There's the persistent widow knocking on the judge's door, and now the persistent mosquito at night as well. Yeah. So thanks for all the knocking.
Or the dripping faucet, right? The leaky faucet.
Okay.
You got to fix the faucet.
Yeah. Which features in the book of Proverbs, of course, in another context. But we're almost out of time, Mike. But I just wanted to come back to one question around mental health. And you've talked about the loneliness and how harmful this is to health. Well, equivalent to smoking 10 cigarettes a day in terms of the damage. But a big emphasis at Gap 13 at Lausanne was on mental health. And you've mentioned a lot of people involved in this in the churches, and also those who were dealing with, post-trauma, psychological trauma as well. Just perhaps a final comment on the role of care for mental health in the ministry of the church and how that would link with the local church, and in particular the contribution that doctors might make.
I think it's essential. I mean, we are a mind, body, and spirit, and the need now is so unbelievably huge with all of the trauma that's being experienced through war, through conflict, through famine. I mean, it seems to be getting worse and worse. And I think we're making progress. There was, like I said, there were many in the Gap 13 who had that as their focus. We've got a couple of collaborative action teams that have formed on the topic. But I can't think of a more appropriate ministry for the church to be involved in. When we become followers of Jesus, we are given the mind of Christ. And that is something I don't think we grapple with enough. But even though we have the mind of Christ, we can still get messed up. And going through traumatic events like we see all over the world, I think demands that the church have a response. We have the primary role, in my opinion, being the largest affinity group in the world. those who have an affinity and a connection with Christ. The impact that could be made would be immeasurable if we took more seriously and implemented more ministries that deal with mental health and trauma. It's just, the opportunity is there. It's just, do we grasp it or not?
Thank you. And our time's up, but I'm tempted to ask you one more question. And I know people do feel free to go. I'm not meaning to be political with this one, but the realities of the last few weeks, we're seeing a new kind of world, aren't we? A multipolar world, and particularly one where the US may be less involved in compassionate response to healthcare needs in the developing world as it's been, or as it has been. We've all seen the impact through organizations of USAID cuts and so on. We don't know what the future holds for that. But I don't want you to talk about the politics of it, but I just wanted to ask you what sort of opportunity you think that this change, these geopolitical changes create for the church, and particularly the healthcare ministry of Christians.
Great question. Yeah, I am not a fan of the way things have been going, but I don't think it's worth our time to weep and moan and wring our hands. I think it's time for creative thinking at the opportunity. The interesting thing I find is the USAID budget was $40 billion. Now, in the overall terms of our budget in the United States, that's pretty small, but $40 billion. But there's an interesting statistic, and I think this just pertains to the US church. But in the West, in the US, the average church attendee tithes only 2 to 3% of their income.
Okay.
If we tithe the basic 10%, guess how much additional money would be in the church's coffers? About $50 billion.
Okay, which is more than the government spends on US.
So I say that to highlight the fact that if the church were, in the members of the church were following through on their commitments of just the basic tithe, the amount available would be sufficient to meet the needs that we now see as a deficit from the USAID drawing back. But then you get into a discussion about the church and how divisive things are in the church itself, right? And I think this is perhaps the most shameful part of what's going on. I think it's more shameful than what the US government is doing is the divisiveness within the church and the disunity. And John 17, the high priestly prayer was that his followers would be one as the Father and Son are one, so that the world would know that Jesus was sent by the Father. And the disunity I think we have, in my mind anyway, and you will find if you disagree with me, but the disunity of the church is a far more serious issue than the present administration and what they're doing in the United States. So,
well, it's a challenging note to finish on. So, thanks for that. So, thanks so much, Dr. Mike Soderling from Health for All Nations, for all your involvement in Lausanne, for your prodding them in good directions, for the overview you've given us today, and for all the questions that you've asked. May the Lord bless you. Look forward to seeing you again soon. Thank you.